Premier, does your Health Minister lack basic competence and understanding of her portfolio?
No.
Are you concerned at all that it appears now that two ministers had no idea about really critical decisions that were being made by their departments?
What I'm concerned to do, Alex, is to allow the process that I've established to run its course. And as you know, that isn't concluded yet. And when it is concluded, there'll be a report, there'll be findings. That's entirely a matter for that process to determine those matters. And once we're furnished with that, then we'll be able to have a more detailed discussion.
What does ministerial responsibility mean to you, and are you confident that your ministers are taking proper responsibility for their portfolios?
I am. All ministers are fully aware that the accountability for those matters that go on within your portfolio, that's a well understood concept, and I'm very confident that everyone in the government fully understands that.
How much value do you place on the health workers' union's call that they have lost confidence in the minister?
Well, they are entitled to a view. They've put that view in fairly colourful terms. What I'd be more focused on, and what I'm happy to commit today, the Chief Medical Officer, Chief Health Officer, others, they meet regularly, as I understand it, weekly in fact, with all health unions, because it's a very important part of their job. The Minister attends not necessarily every one of those meetings, but has attended many of those meetings. If there's any issues that that group or any group in the community, and particularly in the health sector, want addressed, then we're more than happy to sit down and work through those issues. We've done that as a feature of the pandemic.
Do you have confidence in the Health Minister's ability to continue in that portfolio?
I have confidence in all my ministers, otherwise they wouldn't be my ministers.
Are you concerned that the union that represents thousands of the lowest paid health workers, people who work in aged care, some of the workers who you've stood up and shown your support for most days of this pandemic, is calling for your health minister to resign?
Well, I'm very supportive of that workforce, not just in words, might I say, Rachel, but in good faith bargaining, some election commitments we made specifically for that workforce, whether it be providing some of those workers with some career advancement opportunities where they wanted to go and play different roles within the health system. I have had the great fortune in my public life of meeting many, many members, not just of the clinical community, but those who support them. And I'm sure you've heard me say on many, many occasions that health services are delivered by teams of people, and every member of that team, regardless of the role they play, is a very important part of that team. I've got nothing but respect for those workers. Others can form different views about some of these matters. My position is very clear. If there's an issue that needs raising, if there's an issue that needs to be talked about and resolved, then I'm happy to confirm for you that there's a regular process. All health unions are engaged in that, and that's exactly as it should be. If there's any specific issues that need raising, that need to be addressed, then I'm very confident that the officials I've mentioned, and indeed many more, are focused on those things, and they've not as a function of me saying it from this podium. They've been focused on those issues for months and months and months.